Good morning, everybody. Once again, Dr. Salim is here with you guys. Let's discuss some more SPI questions from the ARDMS registry examinations. Let me continue the series we started for the SPI, sonographic principles and instrumentation examination. Let me share the screen with you guys and start it from where we started last time. Okay, let me share the screen. And let's make our SPI examination easier to pass it, clear it on the first attempt. Okay, the question is, which type of imaging modality is used for large size organs? So if the organ is bigger, which of these modalities will work better? Which of these ones? Is it 3D, 4D imaging, harmonic imaging, power Doppler, or elastography? What do you think? Which one? Or sorry, here is another, panoramic imaging. So which of these 5 options will be the correct answer? What do you think? Exactly correct. Agree. So it will be panoramic imaging. That is the correct answer. Absolutely correct. Let's do the next question. Okay, so this question is asking what type of imaging modality is used for the following imaging? This picture is taken. Which modality was used? These are the options. Panoramic imaging, harmonic imaging, elastography imaging, contrast imaging, or motion mode or M mode. What do you think? Exactly, of course. Same question like above we had it. So it is panoramic imaging because look how big area was seen in one picture. So that is panoramic imaging, correct. Let's do the next question. The next question is asking that, let's do it like this. Which of the following is post-processing? Remember, we have 2 types of imaging, correct? Pre-processing and post-processing. So which of the following option is included for that or count for the post-processing? Is it panoramic imaging? Is it harmonic imaging? Is it elastography, 3D, or special compounding? What do you think? Exactly. That is correct. D is the correct answer. 3D imaging, because 3D imaging is actually 2D imaging. All the 2D slices will get together and make a volume imaging. So it's a post-processing. One more process is done by them before they represent on the display. So it is 3D imaging. Okay, next question. Spatial compounding is the average frames, usually 9 frames, that weave anatomy from different angles. Is this true? False? Is it sometimes one of the above, like both of them, or none of the above? What do you think? That is correct. A is the correct answer. True. Absolutely correct. Okay. Now, in which angle of the 2D imaging most of the reflected echoes achieved or received? So if you're doing your 2D imaging and you're, so which angle? I was about to answer the question. So what do you think, in which angulation you will get the maximum reflection? Most reflection will be received. What do you think? Exactly correct. 90-degree, because if you put your probe on a 90-degree, most of the reflection will come back to you. Correct answer. Absolutely agree. Let's do next one. So this question is asking, 3D imaging is as known as which? What is the alternative name for the 3D imaging? What do you think? Is it like a harmonic imaging, panoramic imaging, fusion imaging, volume imaging, elastography imaging? What do you think? Which one is the correct answer in there? Yes, makes sense. D is the correct answer. Volume imaging, because it shows you all the 3 dimensions, correct? So you see like a volume imaging. All the slices become together, post-process, and then we see a volume imaging, correct. Next. The following resolution get improved with harmonic imaging, except. So it looks like there are 4 answers. It means 3 of these resolutions will get improved with the harmonics on when we do harmonics imaging, but there's one resolution which is not affected by harmonics. Like it will not bring any changes on that. What do you think? Which one is that? Exactly correct. Axial resolution, because axial resolution determined by the SPL, special pulse length. So that's the length of a pulse, and that is already chosen and the on the receiver. So it was already said that in the probe, how much will it be a SPL? So that will be not affected by the harmonic imaging. Okay, next question. Okay, so this question is asking, select the correct option. Let me take this out. Question is, it says, select the correct option for the first two even harmonics of 4 megahertz transistor. So if you have a 4 megahertz transistor, what do you think the two even of harmonics will be? Which of the above? Which of the below? Sorry. So what do you think? Correct. B is the correct answer. 8 and 16. How? Because we have a formula. It starts from 1, 2, 3, 4, 5. So 1 is never been a harmonics, because if you multiply anything with 1, it will be the same number. So it means it's not a harmonic. Harmonic starts from number 2. So if you multiply 2 with 4, so 2 is even, 3 is odd, 4 is even, 5 is odd, 6 is even, correct? So in this case, we have the first even number is 2, and the second even number is 4. Now, 2 times 4 will become 8, and 4 times 4 will become 16. So that is the correct answer, B. Correct. Okay, next. Select the correct option for the fourth odd harmonics of 2 megahertz transistor. Now, like if there's multiple odd numbers, of course, but the fourth one. Now, if you calculate it this way, the number 1 odd number is 3. The second is 5. The third is 7. And the fourth is 9. Correct? So now 9 times 2, 18. So that will be the harmonic. So E is the correct answer. Okay, good job. Let's do the next one. Okay, it says harmonic imaging processes are found in which of the following frequencies? Like which frequencies are capable or doing or have this function to activate harmonics on them? What do you think? Is it a low frequency, high frequency? Doesn't matter for both of them, none of them? What do you think? Exactly, low frequency only. Why? Because with the low frequency can penetrate better, but the resolution is bad. That's why we have to make image quality better, and the harmonics works on the low frequency, because high frequency does not need it actually, because it's already a nice picture, right? Next, the most of harmonic frequencies are found in which part of the image? Like if you make your picture top, middle, and bottom of the picture, correct? So now, what do you think, in which part we can find the most harmonics activity? Let's put it that way. Yes, B is the correct answer, on the deeper or very deep portion. Because where there is the most attenuation, because harmonics goes by the attenuation. If you see on the bottom of the picture, it's a little darker. So it's most of the attenuation happen on that area, and image quality is really bad on that area because amplitude is really small now, correct? The loss of amplitude, intensity, and power is in the bottom. So it works in the deeper area, correct? Let's do the next question. Okay. So, question number 92. It says, with harmonic imaging, what happens to the sound beam diameter? What do you think? When we activate harmonics, sonority. So what happens to the beam diameter? Is it get wider, narrow, stay the same, like no effect, has no effect? What do you think? Yes, correct. B is the correct answer. Beam get narrow, more narrow. When you turn on your harmonics, it becomes narrower. That is correct. With the use of elastography, which of the following can be identified if you are using elastography imaging activity? What do we can diagnose easily or better, or like in use for them? What do you think? Is it masses, tumors, lesions, or all of the above? Exactly. This is also called stress imaging. So you compress on the tissue. So all of the above is the correct answer. D is the correct answer. It works for all of these ones, correct? All right. Now, acoustic radiation force impulse imaging is also called or as known as which of the following? What do you think? Is it harmonic imaging? Is it Doppler imaging? Is it panoramic imaging? Is it elastography imaging? Is it magnification? Easy. Exactly. D is the correct answer. It's also called elastography imaging. And that was elastography because you can see this is something you force the tissue a little bit with that. That is correct. Next question. Now, this question is asking that which imaging modality is used for the following image? What do you think? Which modality was used? Is it harmonic? Is it Doppler imaging, elastography imaging, power Doppler imaging? What do you think? Which one was used here? What do you think? Exactly correct. It is elastography imaging also. So that's why we compress and we see if the tissue, we want to know the hardening of the tissue. If it's within the normal limit or abnormal, it will give you different coloring. That is correct. Okay, let's do this question. It says harmonic imaging will degrade or make it worse lateral resolution. Is this true or false or both of them or none of the above? What do you think with harmonic imaging? Is it correct that the lateral resolution degraded? No, false. B is the correct answer because it actually improved lateral resolution. So the question was asked negatively. No, it have positive effect. So it's false actually. Okay, let's do the next question. Okay, a few more questions and then we will stop it there. Okay, now artificial intelligence has the potential to improve accuracy, efficiency, workflow, and productivity of the diagnostic imaging. I mean, that's the easiest question. Is it true or false? Yes, of course it's true. Okay, it helps, correct? Now, A mode or amplitude mode is most commonly used in which of the following modalities? What do you think? Like the most we can use it, A mode, amplitude mode. Is it in the liver for the liver and spleen evaluation? Is it common carotid arteries evaluation? Is it renal study evaluation when we do the kidney studies? Is it ophthalmology for the eye or is it OB/GYN? What do you think? A mode. Correct. Ophthalmology. Yes. For the eye evaluation. D is the correct answer. Now, in A mode, amplitude mode, studies, we can say in A mode studies, depth measurement are done with which axis? When you do A mode studies, so the depth we want to know, it's done by which of the following axis? Is it Y axis or X axis? What do you think? Correct. It is the X axis. Okay, the last question. In M mode studies, depth measurement are done with which of the axis? When you're looking for the M mode, this is M mode. That was A mode, this is M mode, motion mode. So we do the depth measurement with what? Is it with the X axis or Y axis? B is the correct answer. Y axis. Absolutely correct. Okay, thanks a lot. Once again, do not forget to subscribe the channel if you did not yet, and share the channel with those who really need these type of questions, which helps them to make their ARDMS registry examination or CCI, Cardiovascular Credentialing International, or either American Registry of Diagnostic Medical Sonography. Let them to be certified internationally. So just let them know that we have this type of programs too. And just subscribe to get the more notification, correct? And hopefully see you again and take care. Bye-bye.